Many people struggle with mental illness, and like any serious illness, it should be treated. Even with treatment, there will still be struggles. If you are a student, mental illness and your responsibilities can be challenging to handle. Those challenges seem even bigger when you plan on seeking higher education. But there are ways you can help yourself succeed on a path to higher education and make your journey less challenging. According to the National Institute of Mental Health, one of the most important things you can do is seek treatment. In regards to anxiety disorders, NIM states, anxiety disorders are generally treated with psychotherapy, medication, or both. In regards to depressive disorders, NIM states, depression is usually treated with medications, psychotherapy, or a combination of the two. Other illnesses may have different effective treatments. Talk to a therapist, counselor, or psychiatrist to find out what treatments will suit your needs best. If you cannot afford to see a mental health professional, there are likely affordable or free options near you. Many organizations provide free or affordable counseling, especially to youth. When you have mental illness, it can be hard to remember when your mood is low and when it is normal. A mood tracking app or journal can help you and your therapist keep track of how you are doing. Even if your mental illness is being treated, you can still face a lot of challenges. U.S. schools are required to provide accommodations to students with disabilities with an IEP or 504 plan. If you think your illness is getting in the way of your educational performance or your ability to function in a school environment, talk to your school counselor, social worker, or a trusted teacher. It can be hard to advocate for your needs, especially if you have an anxiety disorder. So it might be helpful to find someone you are comfortable with, like a sibling, parent, or teacher, to help you advocate for yourself. You might feel ashamed of your illness, or feel like you're making a big deal out of nothing, but you deserve to have your illness accommodated. If a student cannot walk, they are not forced to take the stairs. According to Phyllis Henderson in her article, Coping with Mental Illness, a program for middle school students, in the journal Elementary School Guidance and Counseling, mental illness should be perceived as similar to any other illness that needs treatment and care. In other words, you are deserving of the accommodations you need. Just because your illness is not physical does not mean your struggles are not valid. A major aspect of succeeding with a mental illness is having successful coping strategies. Different strategies work for different people, but some are damaging and can actually worsen your stress or problem. The most harmful coping strategies are often the easiest to use. In the European Journal of Psychology of Education, the study Coping Strategies and Psychological Well-Being Among Teacher Education Students, Coping and Well-Being in Students, states that avoidance coping strategies are associated with negative psychological well-being. This means that coping strategies that involve avoiding a stressor or ignoring something that causes distress will make your stress worse. This especially applies to situations or problems that you must face at some point. Instead of using avoidance coping strategies, try to use approach and problem-solving coping strategies. So what are approach coping strategies? They are coping strategies that focus on changing how you view a situation. This type of strategy tries to shift a negative perception to a neutral or positive perception. Two particularly helpful methods are radical acceptance and mental reframing. Emmy Pombo, a student who struggles with mental illness, writes in her NIM blog post, Self-Help Techniques for Coping with Mental Illness, that radical acceptance is the idea that no matter what, you cannot change a situation. Essentially, you must accept that something will happen and take action to address that situation. For example, if public speaking gives you panic attacks, accept that you have a hard time giving presentations and work with your teacher to modify assignments that involve presenting to a large group. Pombo also recommends mental reframing, which consists of looking at a stressor and thinking about it in a less negative way. For example, if you are going to be late because of traffic, tell yourself there is nothing you can do about the traffic, so stressing out will not accomplish anything except ruining your mood. This coping method is very challenging, but very helpful. Trying to see situations in a more positive light can greatly decrease feelings of anxiety and depression. So, what is a problem-solving coping strategy? This type of coping focuses on reacting to and resolving problems and stressors. One example of this coping type is the 5 senses technique, which consists of focusing on what each of your senses are experiencing to help ground yourself to reality when in a state of panic or anxiety. Another problem-solving coping method is deep breathing. Breathing can help calm you when you're panicked, as it lowers heart rate and helps relax the body. The most obvious example of this type of coping is removing a stressor. This can mean completing a task, like an assignment, or resolving a conflict, like a fight with a friend. Some coping methods don't fall under any 3 of the types mentioned previously, but that doesn't mean they're not extremely beneficial. One technique that has been shown to really help with mental illness is opposite to emotion thinking. This is a coping method that involves doing the opposite of what your symptoms make you want to do. Want to stay in bed? Go out with friends. Want a nap? Do something productive or fun. This technique is very challenging but also effective in combating mental illness. One other important coping skill is to be aware of your emotions. Allow yourself to feel the way you feel, then address that emotion. If you are angry, let yourself be angry, but then calm yourself down. Do not suppress emotions. Bottling up emotions leads to outbursts and instability. Suppression is a type of avoidance coping, which, as mentioned earlier, is very harmful. My final and most situational recommendation is to adjust your life to suit your needs. This is not possible for everyone, but if you have flexibility in your life, it can be extremely helpful. Make a list of your needs. Make changes to your life that help you meet those needs. For example, if you are overwhelmed at school, take less challenging classes or apply to a good but non-competitive college. If you're overwhelmed at work, change jobs to something you like or has less hours. If you're constantly stressed over friends or hurt by people in your life, cut draining friends out of your life. Obviously, there are only so many changes you can realistically make, but you should make the changes that you can. Dealing with mental illness can be a great struggle, especially when in a high-stress environment like high school or college. But there are ways you can help yourself succeed on a path to higher education, so you can reach your goals. Some of the recommendations in this video may not work for you. Everyone responds to different things. You are not alone. You will succeed. Believe in yourself and your ability to get better.